Welcome back. If you have a medical question, the doctors are in. Email us at greatdayhouston@khou.com. Many times we take our teeth for granted and the process it takes to restore them. Here to walk us through the painstaking process of fitting perfect crowns is dentist Dr. Terri Alani, and Mike Mukar, he custom makes each crown Dr. Alani uses. All right. Earlier we had someone say, why does it cost so much for us to get these things done to our teeth? Well, what's happening behind the scenes, we don't realize, and you're going to walk us through that. But first, I'm going to open my mouth. Do you recognize those girls?
I do.
Okay, he made them, my crowns. All right. So, Dr. Alani, the first thing is we come into the dentist and we figure out what's going on. Mine were some old crowns that just needed to be replaced. That does have to happen every now and then.
Yeah, exactly. Sometimes if a patient's had a crown in for a long time, they can actually you can get decay up underneath them, or the crown can break, it can wear down, because they're really not designed to last forever.
Right.
Basically, a crown can last anywhere from like 5 to 20 years. It just really depends on the patient's habits.
Yeah, and also, if you had them 20 years ago, just technology's also changed since then.
The materials have changed drastically. 20 years ago, basically, most of the crowns had the metal substructure, porcelain on top with metal underneath, of course, that black line that nobody likes. Now, in the anterior or the front teeth, basically, we do all porcelain crowns with no metal whatsoever.
Yeah, you see that black
one's
gone.
And with this picture right here, what we did is the patient had existing crowns on her upper teeth, but you can see the black line. So we went and we replaced with actually the same material, porcelain to metal, but a much better material. And so when she had her lip up and her smile on, you can't see the metal.
Okay, so you come in, you determine whether we might need a new crown or not.
Right.
And so you take a mold.
Right. It starts with the dentist and basically ends with the dentist. So what we do is we prepare the tooth, and then we take an impression of the tooth, and we send the impression to Mike, to the lab, and we actually pour up the impression in stone. So these are went through his lab, and you can see them pouring up the impression in stone right there. And once the impression is made, then I guess you can show what we do is Mike will actually take the model and make a die of the individual teeth, which would be this one right here.
Right.
There we go.
And so each individual tooth that we're working on now, there's actually a die and the margins, and they refine them. It's very technical.
Yeah. All right, so Mike, take us through this point here. So you're looking at something that has to fit perfectly.
It does.
Okay,
It does,
so
absolutely.
what do you do once you make the die? What do you do?
Well, this is the model and die, and it's like the foundation for your house. It has to be sound or it all crumbles. So we've got a replica now of the mouth that's removable, and we can work on each piece.
Okay, and then the process of working on each piece after you have that die is what?
Well, we would typically go to wax in some form and replicate nature, really. We're trying to make a tooth that looks lifelike.
Yeah, it's almost like the only thing I can relate it to, because this gets me excited, is making jewelry.
Exactly. and in this one here, this is actually front crowns, and he had gone in and actually this is just in wax. So you go in and you actually wax it up like it's probably going to look in the mouth, and then the next process is you cast it, go into ceramics, and then how many people do you have actually in your lab?
There's 8 of us.
Yeah, 8, and each one does something different, and it's very technical. How many hours would you say goes into making one crown?
Oh, my goodness. Probably 8 to 10 hours of
for one
hands-on.
crown.
Yeah, yeah.
So that answers the lady's question as far as the expense.
Right.
And you have different types of crowns. We have the all porcelain crowns that we actually do now for even the back teeth, because we have them where they're strong, and there's no metal at all.
Yeah, because when you open your mouth, people don't even know you have a crown there. They think it's your own tooth.
And the thing is, with Mike, we've been working together for a very long time, so when I actually go to seat the crown in the patient's mouth, basically the appointment is maybe less than 30 minutes because there's hardly any adjustment.
Right, and I know you're a perfectionist, and you want to be able to get those crowns and pop them right on. If they need a little tweaking, you're able to do that, but it would just be a little bit of tweaking. But for the most part, you want to make sure it's done right the first time.
Exactly.
So that it fits.
And the difference is I have people that come into my office and they'll go, well, I went down the street and there was a discount lab or a discount dentist and it was much less. What's the difference? There's a huge difference. It has to do with the materials in the crown. For instance, if we have to do a crown that does have a metal substructure and then porcelain on the top, basically it's the type of materials that are used. And what we use is we use either a precious or a semi-precious metal, which has no nickel in it whatsoever, because the black line is caused by the nickel, right?
So it comes from leaching, if you will. Okay. And Terry, let's back up a little bit and talk about when you would need a crown and the difference between needing a filling and needing a crown.
Okay, usually if you have a very large, old, a lot of us have still silver fillings in our mouth. I've got mine taken out, but a filling that compromises mainly 2/3 of the tooth, and that's when you would really, excuse me, want to do a full coverage restoration to protect the tooth from breaking. And we see patients that have come in, and also you can get decay underneath those silver fillings. It will actually strengthen the tooth and help you keep that tooth for a much longer time. So,
yeah. Okay.
And we actually do, I know just on your monitor there was one individual, a picture of an individual tooth. This is a patient that we just restored with one crown, and you can see how it's a perfect match. That's very difficult to do. It's the hardest thing to do in dentistry.
Not only perfect match, it's improved the whole shape of the tooth.
But Mike is really good at that, and we've had a very long-lasting relationship for a long time. We've had our issues, but we get along great. And so you've got to have a really good quality lab. You're only as good as your lab.
Yeah.
And so that's what makes a difference. You don't want to go in and have a less expensive lab or whatever do your dentistry, because you're not going to get the quality that's going to last you for the years.
You want something that fits comfortably, that feels like your natural teeth, and that will stay in. All right, and look good too. Dr. Alani, thank you very much. Thank you very much. Dr. Alani has a special offer. The first 20 callers will get a complimentary exam and x-rays. That number is 713-621-5141, 713-621-5141 if you need to get your teeth checked out. For more information, you can also go to her website, texastoothlady.com. You can also hear her and her brother, Dr. Wayne Alani, on their radio show, For Your Health. He's an orthopedic surgeon. It airs on 6:50 a.m. every Tuesday at 1 p.m. Up next, the latest way to get rid of unwanted fat has just been